Welcome back. Well, we already knew that during the pandemic, there was a drop in children receiving vaccinations. Now, new data from the CDC shows that the number of kindergartners getting those routine childhood vaccinations still has not returned to pre-pandemic levels. Data also shows that exemptions from school vaccination requirements jumped to 3% during last school year. That's the highest level ever seen, actually. Dr. Curry-Winchell joins us now for a closer look at these numbers. She's a physician and a health equity advocate and friend of the show as well. Doctor, always great to have you with us. Thanks for joining us. So let's dig in first. I just want to read some of these statistics. So last school year, it was about 93% of children in kindergarten that met the vaccination requirements. That is lower than the 95% seen in 2019 to 2020 before the pandemic. 40 states also saw rises in parents citing religious or other personal concerns for not vaccinating their young children. I have to say, doctor, after there was so much confusion and kind of a lot of contention around the vaccine during COVID and around the rollout and a lot of misinformation, I guess I'm not that surprised, but I'm just wondering, especially since we're talking about those routine vaccinations, as a medical professional, does this data surprise you?
It does not surprise me. We know, based on the history of so much divide, when we talk about vaccinations, that this was likely to happen, and it's continued to happen, unfortunately, which has now really affected the disease rates that were really non-existent before, and now we're seeing pop-up of diseases that we've never seen before.
Let's talk, though, about the concern around the fact that, like I mentioned, this is just kids going into kindergarten getting those vaccines generally. We're not just talking about the COVID vaccines. Why is it that you think we're seeing such a significant drop in vaccination rates when it comes to those types of shots?
Well, you know, a lot of parents and caregivers are just really feeling a mistrust with the flu vaccine, even standard vaccinations that were a part of a child's, wellness check. And so, unfortunately, that mistrust is now leading to our kiddos not getting vaccinated as they did before. And so we really have to look at what can we do to combat this, because we even saw years before where we were seeing polio, other diseases that were eradicated now are back.
What's the solution here? What do you think? How can medical professionals help put patients at ease and rebuild their trust in vaccines, knowing that a lot of people have valid concerns and confusion over what's happened over the last few years?
Well, I think it's important that we invest in really listening to our patients. For me, I ask my patients, and the parents, what is it that's stopping you from vaccinating your child? And so I think if we as a whole can lean into that and find out where that mistrust lies, it allows us to provide credibility and really combat that mistrust. So as a whole, we've got to listen, and then we've got to respond and provide credible information.
And doctor, give us some tips as we head into the holidays. First of all, of course, it's colder. A lot of people get sick anyway, and then we're gathering with so many people because we're celebrating, and we're doing so indoors. Walk us through some reminders here, because we have, heard about the flu shot. We know about this new COVID booster. Should people be getting that? What should people know as we head into these next few months?
So it's important to still get vaccinated. However, when you are feeling ill, any symptoms, it's important to have tests with you. And so if you're traveling or if you're at home, we now know that tests are available. So that's important. Also, if you're going to be out of state, look for your local urgent care or facility just in case. And I think the biggest thing we can all do for our family and our loved ones so we can celebrate is, if you're not feeling well, go ahead and seek out help. That's important. Get tested so you don't accidentally infect somebody else.
Important reminders here now that we've been in this for a while. Dr. Curry, thank you very much for joining us.